If you're over 50, your body has been sending you messages for years, and some of those messages might be warning signs of diabetes that you've completely ignored, brushed off, or blamed on just getting older. I'm a physician, and in my years of practice, I've seen countless patients walk into my office convinced their only problem was aging, tired joints, or stress, when in reality, their blood sugar had been quietly climbing for months, sometimes years. Today, I want to share with you the hidden, surprising symptoms of diabetes that often go unnoticed after 50. Symptoms that have nothing to do with the classic thirst and frequent urination you've probably heard about 1,000 times. Stay with me until the end, because symptom number 7 is one that almost nobody connects to blood sugar, and it could be the one warning sign sitting right in front of you. Let's start with something most people would never associate with diabetes: your eyesight. Many of my patients over 50 come in complaining that their reading glasses suddenly don't work anymore, or that their vision seems to fluctuate from morning to evening. They assume it's just their eyes aging, so they get a new prescription. But weeks later, the blurriness comes back. What's actually happening is that high blood sugar causes the lens of your eye to swell and change shape, leading to blurry or fluctuating vision. This is often one of the very first signs of diabetes, and it's frequently dismissed as a normal part of getting older. Next, let's talk about your skin, specifically dark, velvety patches that can appear on the back of your neck, your armpits, or even your groin area. This condition is called acanthosis nigricans, and it's essentially your skin telling you that your body isn't responding properly to insulin. I've had patients tell me they thought it was just dirt that wouldn't wash off, or a strange rash from sweating. In reality, this darkened skin is a visual signal of insulin resistance, and it often shows up well before a diabetes diagnosis is made through blood work. Now, here's one that catches almost everyone off guard: slow healing cuts and wounds. If you've ever nicked yourself shaving, or scraped your shin on the edge of a coffee table, and noticed that what used to heal in a few days is now taking weeks, that's not just your body getting older. High blood sugar damages blood vessels and nerves, which slows circulation and the body's natural healing process. I once had a patient whose paper cut from opening mail took nearly 3 weeks to fully close. He thought it was unusual, but didn't think much of it, until his blood work revealed pre-diabetes. Let's move to something incredibly common, but rarely linked to diabetes: tingling, numbness, or a pins and needles sensation in your feet or hands. Most people over 50 chalk this up to sitting too long, poor circulation from age, or even an old injury. But this sensation, known as peripheral neuropathy, can be one of the earliest nerve-related signs that your blood sugar has been elevated for an extended period. It often starts subtly, maybe just in your toes at night, and can be easy to dismiss until it becomes more persistent. Here's a symptom that's often overlooked because it seems completely unrelated: recurring yeast infections or urinary tract infections. Elevated glucose levels create the perfect environment for yeast and bacteria to thrive, particularly in warm, moist areas of the body. If you find yourself dealing with these infections more frequently than you used to, especially after 50, it's worth having a conversation with your doctor about checking your blood sugar levels. Now let's talk about fatigue, but not just the "I didn't sleep well" kind of tired. I'm talking about a deep, persistent exhaustion that doesn't improve no matter how much rest you get. This happens because when your cells become resistant to insulin, they can't efficiently use glucose for energy, even though there's plenty of sugar circulating in your bloodstream. Essentially, your body is starving for energy at the cellular level while swimming in sugar. Many people over 50 attribute this fatigue to menopause, stress, or simply slowing down with age, but it can be a significant red flag. And now, the symptom I promised you, the one that catches almost everyone by surprise: unexplained weight loss, even when your appetite hasn't changed or has even increased. This might sound backwards, since most people associate diabetes with weight gain, but when your body can't use glucose properly, it starts breaking down muscle and fat for energy instead. I had a patient in her late 50s who was thrilled when she dropped 15 pounds without trying, until further testing revealed her blood sugar was dangerously high, and her body had essentially been running on empty for months. Here's the truth. Diabetes after 50 doesn't always announce itself with dramatic symptoms. It whispers. It shows up as blurry vision you blame on tired eyes, a cut that takes too long to heal, skin discoloration you scrub harder to remove, or fatigue you attribute to simply getting older. The problem is that by the time these whispers become impossible to ignore, the condition has often progressed significantly, sometimes leading to complications involving the heart, kidneys, eyes, or nerves. The good news is this: catching these signs early can make an enormous difference. Type 2 diabetes, especially in its early stages, can often be managed and sometimes even reversed through lifestyle changes, dietary adjustments, increased physical activity, and, when necessary, medication. But none of that can happen if the warning signs go unrecognized. So here's what I want you to do. Take a moment right now and think back over the last several months. Have you noticed any of these signs? Vision changes, slow healing wounds, unusual fatigue, skin changes, tingling in your extremities, recurring infections, or unexplained weight loss? If even one of these sounds familiar, don't wait for your next annual checkup. Schedule an appointment, request a simple blood glucose test, and have an honest conversation with your doctor about what you've been experiencing. Your body has been talking to you. The question is whether you've been listening. After 50, every year matters more, and catching something like diabetes early isn't just about avoiding a diagnosis, it's about protecting your independence, your energy, your vision, and your quality of life for decades to come. Don't let these symptoms slip by as just getting older. Sometimes the most important health discoveries come from paying attention to the things we're most likely to ignore. If this information resonated with you, share it with someone you care about, a parent, a sibling, a friend over 50 who might be brushing off symptoms just like the ones we talked about today. Sometimes the people closest to us are the ones least likely to take their own health seriously, and a simple conversation sparked by something like this could lead them to get checked out before things become more serious. Take care of yourself. Listen to what your body is telling you. And remember, early detection isn't just powerful, it's life-changing. I'll see you in the next one. And until then, stay healthy and stay aware.